Hey everybody, it's Nick here. I'm going to be talking about something that we have actually seen a lot through our clinic, hyperphosphatemia in canines in general. It's prevalent in a lot of different species, felines, equine, humans in general, but canines specifically for this, and just all ages. There's different scenarios that we kind of look at whenever we come across these levels, but I'll get into that. So hyperphosphatemia is just high phosphorus levels in the blood. Now, phosphorus, also known as dicalcium phosphate, it's one of I think the second most important mineral in our bodies, or in a dog's body for sure, canines, next to calcium. Mainly used for the health of the bones or teeth and their metabolism. By itself, phosphorus is not very stable. Usually it's combined with calcium in the body, and they're like a yin and yang type of scenario with each other. Now again, most of it is stored in the bones, I think like 85%, and then 10 to 15% of it kind of circulates through the bloodstream just on average, just normally. And it's also one of the most essential vitamins for healthy kidney function. So middle-aged and elderly canines, hyperphosphatemia is usually routed straight back to renal failure. Some sort of kidney issue going on, or thyroid issue, which we'll get into as well, and in some other cases diet, mainly kidney failure. Kidney disease is usually the underlying cause, but diet can also be an issue if there's too high of a phosphate level in their diet. So in adolescent canines, hyperphosphatemia is often due to increased intestinal absorption, and then the kidneys just aren't absorbing as much phosphorus as necessary because they're not used to looking for that. I would like to note, usually the large breed dogs, because they have more bone development, they have more growth spurts. They're just bigger in general, so their bones need a little bit more mineralization. Phosphorus is used to facilitate that, the hardening of the bone. So that's normal to have high levels in young dogs, your Mastiffs and really big Shepherds, Great Danes, stuff like that. In all age groups, dehydration, parasites can cause it as well. Trauma is not as common, and then poisoning, either by raisins or grapes, and then an excess of vitamin D is one of the big ones that we see as well. It's usually supplements that owners are giving their pet that they're not, aware of. Most of the symptoms I have on here, but I'll run through them real quick. So PUPD stands for polyuria and polydipsia, which just means they're drinking a lot and peeing a lot. Usually hand in hand, more common with just your basic urinary tract infections, but that is one of the symptoms as well. Dilute urine. So when you run a urinalysis or a blood test, either way that comes with the urinalysis, it will check something called a specific gravity, which is how well your kidneys are filtering one, urine, but just fluid in general, how well they're doing, concentrating the urine. I believe water, H2O, is 1, and typically in the veterinary field, we like to see a 1050. 1.050. 1050 or greater is a really good specific gravity. Usually anything under a 1010 we start really being concerned with. Dehydration, same as in people. We usually look at gum color for that, or the tint of the skin behind their neck. Inappropriate urination, are they having issues holding it? Are they incontinent? Has that been ruled out? And a lot of age plays into that as well. Weight loss, rapid weight loss typically, and seizures and muscle atrophy. Muscle atrophy is just the thinning or wasting of the muscle. A lot of times it's in the back legs, but it can be all over. And last I put on here as well, I'm doing hyperphosphatemia. It's much more common in domesticated canines than hypophosphatemia, which is low phosphorus levels. That's rare. It happens, but it's usually, again, diet related. There's not enough of it there, and for that, a lot of times you can just supplement and it kind of corrects itself. Let me go back here actually. So yeah, so this little chart I have to the side, it was hard to find a picture of a dog that was dealing with hyperphosphatemia, but without just typing in sick dog. So you can kind of see this is all one big wraparound that ends in typically two or three different issues. So renal disease can cause hyperphosphatemia. Hyperphosphatemia can cause renal disease. It's really it's not that complex, but it's kind of frustrating sometimes. So the kidney kind of pulls phosphorus out of the intestinal tract and filters it. Your kidney's job is to get rid of waste and to produce urine, waste from the blood. So if the kidney is not doing its job well, if it's not disposing of this waste, your kidney values will increase because there's too much waste in the kidneys. And one of the increases is the hyperphosphatemia, the increased phosphorus value. So you can see kind of there in the middle, the hyperphosphatemia, it can lead to calcium and phosphate deposition, soft tissue calcification, which can lead to cardiac disease or back around to renal disease. Too much vitamin D, again. PTH at the bottom, that is parathyroid hormone. So when your thyroid, basically when your thyroid is producing too much of the hormone, it can cause a decrease, I believe, in calcium, decreased levels of ionized calcium, which triggers the thyroid to produce more of that hormone. That in return makes the body, it calls for more calcium, and it pulls that calcium from the bones. Pulling that from the bones weakens the bones, so you can end up with something like uremic bone disease, which is weakened bones. It's abnormal bone growth at that point. So that's the best explanation I could find for that. Natural sources of phosphorus, mainly the foods. Variety of foods contain phosphorus. Richest ones are your red meats and seafoods, poultry as well. We call them organic phosphorus, which is just, natural source of. It's absorbed more efficiently from animals than plants. For most canines, the chicken, turkey, and duck are the three top ones that have the high levels of phosphorus. And the other examples on here as well. Mitigation for hyperphosphatemia. As it stands with the underlying conditions that cause it, renal failure, hypocalcemia, again, the calcium and phosphorus are kind of a yin and yang. So low calcium, high phosphorus, low phosphorus, high calcium. All you can really do is make sure, kind of keep an eye on it, unless you're seeing symptoms. And the problem is, one of the big causes is renal failure. The problem is we typically don't see symptoms of renal failure in animals, dogs specifically, until their kidneys have lost almost 2/3 of their function, which is why it's called chronic kidney disease. It's really sucky, actually. So getting blood work done, ideally every 6 months is perfect, but at least annually, I think, is the golden standard of medicine. And it kind of helps keep a check on these conditions, or if we're concerned, get a look at. If not, it helps us to create a baseline at least. And the baseline makes it to where if we do notice an increase or decrease in levels, there's a way to kind of gauge the severity, but also the quickest route of action necessary to save the pet's life, prolong it, help give the best quality of life, whatever the case may be. And then given those results, we can decide whether the pet needs to be placed on a different diet, if it's a simple dietary indiscretion or anything along those lines. Placed on a phosphate binder, which is kind of where if the kidney is soaking up too much of the phosphorus and not excreting it properly, the phosphate binder will bind the phosphate basically back inside the gastrointestinal tract so that it's not overloading the kidneys. Or again, start treatment for the underlying condition or disease. Kidney failure, aggressive fluid therapy, and phosphate binder again, and then pretty regular blood work to kind of keep up on that. These are, well, I didn't show them, but this is 2 very good citations to go over. I found them on Google Scholar, and they're both used through the AVMA, which is a great source as well. Thank you guys. Hope you enjoyed.